We have a very close relationship with the doctors and paramedics and other staff that work for Magpas. When Magpas deliver a patient, it's either a critically ill patient or a critically sick patient, patients often delivered in a much more packaged, much more controlled manner than used to happen when I first started working in the emergency department. The teams within Magpas have the ability to, for instance, put the patient to sleep and intubate them. And we know that if you take control of the airway, for instance, outcomes from head injuries are much better if you begin treatment at the roadside rather than delaying it until they arrive in hospital. So we recognise that the patients they deliver to us have a much better chance of surviving than they would if they were just brought in without any treatment, for instance. I think we also know them on a much more personal level, so for instance the handover of care is much easier. We trust them, they understand the type of information that we require from the roadside. When we talk to them over the airwaves when they're at scene, it allows us to mobilise our teams much more quickly. So I think it's around knowing them, trusting them. They understand our processes, so they give us time to prepare for these very, very sick patients. It's taking critical care to the roadside, and by critical care I don't mean sort of intensive care medicine, but I mean it's those life-saving skills that some of these injured and very sick patients require almost immediately, so that you minimise delays, you make sure that the patient's brain is being oxygenated, you're giving them fluid and bringing them in as rapidly as possible. East Anglia, or the east of England, is the pilot site for training in what's soon to be the newest specialty in medicine, which is pre-hospital emergency care. And we are very fortunate to have some of those trainees who participate in our rotas. So they come here really to go back to their host specialty, which is usually emergency medicine or anaesthesia, whilst they train in pre-hospital care medicine under the supervision of two consultants who are currently working, who have part-time contracts in our trust as emergency physicians. So clearly we get to know them very well. We're closely allied with pre-hospital emergency care. We want to make the transfer of care as seamless as possible. But I think also the other important distinguishing feature about Magpas is their level of clinical governance. Their ability to review all the care that they deliver in some very difficult circumstances and learn from what went well and what perhaps could be improved the next time is frankly something that we should all aspire to, really. And I think the same levels, because they have that level of clinical governance and sharing of the learning, that has helped develop our relationship. I have the greatest respect for those clinicians and be they doctors and paramedics who go out and work in teams in some pretty uncomfortable environments and weather. But I know that, God forbid, if either myself or my family are ever injured in a road traffic accident or any other road traffic accident, I want a Magpas team to come out and look after me.